Bismillahirrahmanirrahim. Quote for today is and seek help through patience and prayers. Today the topic of my presentation is Zika virus and I'm presenting it under the supervision of my professor Dr. Saira Hussain. Learning outlines of the presentation are introduction and problem statement, mode of transmission, clinical features, prevention and control, treatment, recent updates, and MCQs at the end. At the end of this presentation, participants will be able to describe about the Zika virus, its prevalence, mode of transmission, clinical features, prevention and treatment, along with the recent updates at the end. I'm presenting a case of a patient that is suffering from Zika virus. A woman that is 27 years old, resident of Kachi Abadi, Lahore, married for 2 years, presented to an IOPD. Department of Mayo Hospital with a history of headache, fever, and both red eyes. On inquiring, she told about having joint pain also. She is in her third trimester of pregnancy. She told that his husband had the same symptoms about a week back and he got recovered from it, but she is still not getting any relief from local medications. Physicians suspect some viral illness. To confirm, he asked for some lab test and obstetric ultrasound to check fetal well-being. Lab profile were hemoglobin was 9.43, neutrophils were normal, PT APDT were 20 and 35 respectively. LFT shows AST 27 and ALT 32. Dengue antigen shows negative viral markers, and obstetric ultrasound shows a fetal head a little lesser than expected. Serological studies show RNA virus positive for Zika virus. So the patient was suffering from infection of Zika virus. Now, what is Zika virus? Zika virus is a positive sense RNA flavivirus in the family Flaviviridae, which also includes dengue, West Nile, yellow fever, Japanese encephalitis viruses. Zika virus is a mosquito-borne flavivirus that was first identified in Uganda in 1947 in monkeys. It was later identified in humans in 1952 in Uganda and the United Republic of Tanzania. The problem statement is outbreak of Zika virus disease has been recorded in Africa, America, Asia, and the Pacific. From the 1960s to 1980s, rare sporadic cases of human infections were found across Africa and Asia, typically accompanied by mild illness. The first recorded outbreak of Zika virus disease was reported from the island of Yap in 2007. This was followed by a large outbreak of Zika virus infection in French in 2013 and other countries and territories in the Pacific. In March 2015, Brazil reported a large outbreak of rash illness, soon identified as Zika virus infection, and in July 2015, found to be associated with Guillain-Barré syndrome. In October 2015, Brazil reported an association between Zika virus infection and microcephaly. Outbreaks and evidence of transmission soon appeared throughout the Americas, Africa, and other regions of the world. To date, a total of 86 countries and territories have reported evidence of mosquito-transmitted Zika infection. Sorry. Now, the transmission of Zika virus. Zika is spread mostly by the bite of an infected Aedes species mosquito. These species bite during the day and night and prevent Zika by avoiding mosquito bites. Zika can be passed from a pregnant woman to her fetus. Infection during pregnancy can cause certain birth defects. Zika can be passed through sex from person who has Zika to his or her sex partner. However, a barrier method can be used to change the chance of getting Zika. Condoms also can be used by both male and females. Through mosquito bites. Zika virus is transmitted to people primarily through the bite of an infected Aedes species mosquito. These are the same mosquitoes that spread dengue and chikungunya viruses. These mosquitoes typically lay eggs in or near standing water in things like bucket, bowls, animal dishes, flower pots, and vases. They prefer to bite people and live indoors and outdoors near people. Transmission is from mother to child. A pregnant woman can pass Zika virus to her fetus during pregnancy. Zika is a cause of microcephaly and other severe fetal brain defects. A pregnant woman already infected with Zika virus can pass the virus to her fetus during the pregnancy or around the time of birth. Zika virus has been found in the breast milk. Possible Zika virus infection has been identified in breastfeeding babies, but Zika virus transmission through breast milk has not been confirmed. Through blood transfusion. To date, there has been not any confirmed blood transmission cases in the United States, and there has been multiple reports of possible blood transfusion cases in Brazil. It can be passed from a person with Zika before their symptoms start, while they have symptoms and after the symptoms end. Anyone who live in or travel to an area with the risk of Zika and has not already been infected with Zika virus can get it from mosquito bites. Once a person has been infected, he or she is likely to be protected from future infections. This is the map where countries or territories where the current Zika outbreaks are shown. Now the clinical features of the disease. Many people infected with Zika virus won't have symptoms or will only have mild symptoms. The most common symptoms of Zika are fever, rash, headache, joint pain, conjunctivitis, that is red eyes, and muscle pain. How long symptoms start? Zika is usually mild with symptoms lasting for several days to a week. People usually don't get sick enough to go to hospital and they very rarely die of Zika. For this reason, many people might not realize they have been infected. Symptoms of Zika are similar to other viruses spread through mosquito bites like dengue and chikungunya. The incubation period, that is the time from exposure to symptoms of Zika virus disease, is estimated to be 3 to 14 days. The majority of the people infected with Zika virus do not develop symptoms. Complications of Zika virus. Zika virus infection during pregnancy is a cause of microcephaly and other congenital abnormalities in the developing fetus and newborn. Zika infection in pregnancy also results in pregnancy complications such as fetal loss, stillbirth, and preterm birth. Zika virus infection is also a trigger of Guillain-Barré syndrome, neuropathy, myelitis, particularly in adults and older children. Now, congenital Zika syndrome includes other malformations including limb contractures, high muscle tone, eye abnormalities, and hearing loss. The risk of congenital malformations following infection in pregnancy remains unknown. An estimated 5 to 15% of the infants born to women infected with Zika virus during pregnancy has evidence of Zika-related complications. Congenital malformations occur following both symptomatic and asymptomatic infections. Failure to observe signs of Zika virus, congenital Zika virus syndrome, particularly when assessed in utero, does not necessarily mean that the fetus or newborn does not have abnormalities. For example, some abnormalities such as hearing and sight problems may not be detected in utero, but only after birth. Some signs such as seizures may develop only after birth. These are the babies that have congenital Zika syndrome. Now, Zika virus associated with Guillain-Barré syndrome. The incidence of Zika virus associated with the syndrome is estimated to be 2 to 3 cases per 10,000 infections, which is similar to the risk associated with a Campylobacter infection. The interval between antecedent illness and onset of Guillain-Barré syndrome is 5 to 10 days, which has led to speculations about a contributory para-infectious process. Acute inflammatory demyelinating polyneuropathy, acute motor axonal neuropathy, and Miller-Fisher syndrome has been observed with Zika virus-associated Guillain-Barré syndrome. Now, diagnosis of infection with the Zika virus may be suspected based on symptoms of person living in or visiting areas with Zika virus transmission and or Aedes mosquito vectors. A diagnosis of Zika virus infection can only be confirmed by laboratory test of blood or other fluids such as urine or semen. A definitive diagnosis relies on nucleic acid testing or serological testing. A positive nucleic acid test shows the presence of Zika virus RNA, but does not necessarily indicate the presence of infectious virus. Confirmation of the inconclusive and positive IgM result requires the further testing with the plague reduction neutralization test, which can be performed only at highly specialized reference laboratories and is also subject to false positive result. The treatment. Treatment of Zika virus is usually mild and requires no specific treatment. People sick with Zika virus disease should get plenty of rest, drink enough fluid, and treat pain and fever with common medicines. If symptoms worsen, they should seek medical care and advice. There is currently no vaccine available. However, primary prevention includes a protection from mosquito bites during the day and early evening is a key measure to prevent Zika virus infection. Special attention should be given to prevention of mosquito bites among pregnant women, women of reproductive age, and young children. Personal protection includes wearing clothes, preferably light colored that cover much of the body as possible, using physical barriers such as window screens and closed doors and windows, and applying insect repellents to skin or clothing that contains DET according to the product label instructions. Secondary prevention, the controlling of the spread of Zika virus. It requires multifaceted approach which should only be concerned with vector control. This includes protection from infection and unwanted pregnancies through supporting equitable access to sexual and reproductive health commodities and services. It also includes risk communication, providing usable and contextualized knowledge on Zika. Aedes mosquitoes breed in small collections of water around homes, school, and work sites. It is important to eliminate these mosquito breeding sites, including covering water, storage containers, and removing standing water in flower pots, cleaning up trash, and used tiles. For regions with active transmission of Zika virus, all people with Zika virus infection and their sexual partners should receive information about the risk of transmission of Zika. WHO recommends that sexually active men and women be correctly counseled and offered a full range of contraceptive methods to be able to make an informed choice about whether and when to become pregnant in order to prevent possible adverse pregnancy and fetal outcomes. For regions with no active transmission of Zika virus, WHO recommends practicing safer or abstinence for a period of 6 months for men and 2 months for women who are returning from the areas of active Zika virus transmission. In accordance with the standardized planning best practice, it provides an update of progress against the Zika strategic response plan that was revised in July 2016 to December 2017, which remains the main strategy document. This is the document given by the Zika strategic response plan and quarterly updates. This shows that WHO is supporting countries to control Zika virus disease by taking actions outlined in the Zika strategic response framework. Advancing research in prevention, surveillance, and the control of Zika virus infection and associated complications. Developing, strengthening, and implementing integral service symptoms for Zika virus and associated complications. Strengthening the capacity of laboratories to test for Zika virus infection worldwide. Supporting global efforts to implement and monitor vector control strategies aimed at reducing Aedes mosquito populations. Strengthening care and support of affected children and families affected by complications of Zika virus infection. This is the strategy given by the name of countries and territories that report mosquito-borne Zika virus transmission. By coordination, the 4 steps are important, that is detection of the virus, prevention from virus, care and support after treatment, and research that will generate data and evidence needed to strengthen public health and community guidance and interventions to prevent, detect, and control Zika virus infection and manage the complications. With this quarterly update, WHO and partners have revised the overall funding requirements for October 2016 through December 2017, with the US dollar about 112.5 million mobilizing resources. Against it, this budget is necessary to effectively implement ongoing and planned activities in accordance with the evolving Zika response. WHO and its partners have immediate priority for areas for funding, which includes an investment in research, prevention of adverse health outcomes associated with Zika virus infection, and care and support of the destabilized health system. This is the list given by the funding received by WHO and selected group of partners from February to October 2016. This shows the fundings given. The most fund is given for research purpose, and the minimum is given for coordination. Now, recent updates. Zika virus in Pakistan is just the tip of an iceberg. This article states, besides exhibiting similar clinical signs to those of dengue and chikungunya, Zika virus disease is associated with the congenital microcephaly and Guillain-Barré syndrome, a matter of utmost concern. Of particular note is the recent increase in GBS cases of unknown etiology in Pakistani population. Although no clinical case of Zika virus disease has been notified in Pakistan, the first serological traces of infection dates back to 1983. An important factor that might obscure Zika virus detection is the lack of national unified herbivorous surveillance system. This is the map that is shown by the qualitative risk analysis of Zika virus introduction in Pakistan via air. Now, Zika virus infection after the pandemic. The pandemic is illustrative of the universal failure of vector control program in regions where rapid urbanization and interconnectivity promotes epidemic spread. However, new vector control approaches such as those that involve genetically modified mosquitoes are under evaluation. The Zika virus pandemic has waned, but the virus still poses a public health threat as shown by continued reports of outbreak in Asia, India, and Africa. Now coming towards the MCQ session. First MCQ is, the first recorded outbreak of Zika virus disease was reported from the island of Yap, that is Federated States of Micronesia, in 2007. Which of the following is the most common mode of infection in humans? Option A, blood transfusion. Option B, ingestion of oocytes. Option C, ingestion of virus containing food. Options D, transplacental, and option D, through eat through drinking water. Option D is the right one. Transplacental is the most common mode of transmission. Second MCQ is, a person ABC is experiencing from fever and headache for last 3 days. He is taking medication from tertiary care center. All his test reports are okay. However, he recently visited a place of Zika virus outbreak. What is the treatment for Zika virus fever? Option A, Zika vaccine. Option B, antibiotics. Option C, antiviral medication. Option D, there are no vaccines or medications specifically to treat Zika fever. And option E, antimicrobials.
C.
Option D is the most appropriate because there are no specific vaccines available for Zika virus. Third MCQ is, Zika is usually mild with symptoms lasting for several days to weeks. People usually get sick enough to go to hospital and they very rarely die of Zika. How is Zika fever diagnosed? Option A, blood test. Option B, skin samples. Option C, X-rays. Option D, none of the above. And option C is CT scan. Option A is the right one. By blood testing, Zika virus can be diagnosed. Fourth MCQ is mosquitoes are members of the group of almost 3,600 species of small flies within the family of Culicidia. The word mosquito is Spanish and Portuguese for little fly. Aedes mosquito species is responsible for the spread of option A Zika virus, option B chikungunya, option C dengue, option D all three of the viruses, and option E malaria. Option D is the right one. All three viruses are spread by this mosquito. Zika is spread mostly by the bite of an infected Aedes species, Aedes aegypti and Aedes albopictus. These mosquitoes bite during the day and night. What is the incubation period of Zika virus? Option A 3 to 14 days. Option B 2 to 7 days. Option C 10 to 15 days. Option D 1 to 2 days. And option E 1 to 2 months. Anyone? Option A is the right one. 3 to 4 days is the incubation period of Zika virus. In October 2015, Brazil reported an association between Zika virus infection and microcephaly. To date, a total of 86 countries and territories have reported evidence of mosquito-transmitted Zika infection. Which of the following is true regarding Zika virus? Option A, viral load is more in blood than semen. Option B, Zika virus has been found in breast milk too. Option C, Zika transmits through saliva. Option D is high-grade fever is characteristic feature. Option E is low-grade fever is a characteristic feature. D. Option B is the right one because Zika virus has been found in the breast milk too. Seventh MCQ, primary prevention refers to actions aimed at avoiding the manifestation of a disease. This may include actions to improve health outcome. There are many diseases that can only be prevented, not treated. The best prevention strategy against Zika virus is option A, antiviral drugs. Option B, vaccine properly. Option C is mosquito bite prevention. Option D, family planning. And option E, prophylactic antibiotics. C. Yes, option C is the right one. Mosquito bite protection is the best prevention strategy. Now, 8th MCQ is a person XYZ presented to an OPD with a history of red eyes, headache, and fever. He was saying he might have dengue fever, but his course of illness suggests another viral illness like Zika virus. The diagnosis of Zika virus includes option A, presence of viral DNA in the blood. Option B, presence of viral RNA in the blood. Option C, presence of viral protein in the blood. D is the presence of viral RNA in saliva. And option E, presence of viral proteins in saliva. Option B is the right one, presence of viral RNA in the blood. Ninth MCQ is an infant born to a mother that had Zika viral illness in her first trimester, then become fine, delivered her baby through SVD. Now the baby has small head than the normal and muscles are tensed and thought for baby. The baby can have which of the following disease most likely? Option A, congenital varicella syndrome. Option B, congenital tetanus syndrome. Option C, congenital Zika syndrome. Option D, congenital hypothyroidism. And option E is congenital hyperthyroidism. C. Option C is the right one. The baby is suffering from congenital Zika syndrome. 10th MCQ is a young girl presented with the weakness of both legs, diagnosed with GBS. Guillain-Barré syndrome is a rare disorder where body's immune system damages nerve. The damage to the nerves causes muscle weakness and sometimes paralysis. GBS can happen almost how many days after the Zika virus? Option A 1 to 2 days, option B 2 to 3 days, option C 5 to 10 days, option D 1 month, and option E 3 months. Option C is the right one, 5 to 10 days is the time. This is the key of MCQs. This is the YouTube link of our channel. And thank you, Atal.
Thank you very much, Dr. Isma. Excellent presentation, and especially your pitch of voice and your presentation slides, both are excellent. And the most important part that you have presented about Pakistan and the research opportunities that are available, this is really a food for thought. And as MCQ part is concerned, very nicely made, each and every well thought MCQ. Very well done. Keep it up. And I'm so proud of you all.
Thank
So
you.
see you today in the department. Inshallah. Allah Hafiz.
Allah Hafiz.